Right, okay, I hope I'm live now. This is one of the papers I worked on together with Nico Dhillon, who is a very motivated young junior doctor. I think he wants to be a lecturer. And this time he was interested in nocturnal enuresis due to the fact that we had some patients with these problems on the board, and I could motivate him to do a systematic review. The reason for you to watch this would be first to learn something and to be aware about the high risk of nocturnal enuresis in clozapine, and to not to forget to ask the patients. And the other thing is, what people who might have an interest in research can have a look at is what little has been done on this type of research, even though their clozapine clinic permanently collecting buckets of data. Anyway, so that's how we start. Dr. Dhillon looked at the, just trying to find this research. We looked at all the papers who had the word nocturnal enuresis, schizophrenia, and clozapine. We got all these papers because there weren't so many. In the references, we found 12 additional articles, and there was some exclusion criteria, which are all mentioned in the paper here. Article selection, so these are positive. They should report on the prevalence and should be either cross-sectional, prospective, or cohort studies. They should talk about, the patient should be taking clozapine. All major psychotic diagnoses, mostly schizophrenia, were included, and patients who take other concurrent medication were not excluded. Right, okay. We excluded data papers we couldn't read, or who just mentioned clozapine and nocturnal enuresis as side effects without mentioning any data or without looking at data. So we then looked at these papers, and we excluded quite a few. Some were not in English, some were just review articles, they're just case reports. Other were not relevant. Focus on daytime urinary incontinence as a side effect of clozapine. And 3 papers, interestingly, were about managing urinary incontinence with clozapine, which seems to have worked in some patients, but it reoccurred after the doses of clozapine was increased. Right, and there was one guideline. So we had 8 papers together, and just to stop boring you, usually it's more frequent in females. So even though schizophrenia is more, let's say, clozapine is more given more often in schizophrenic, who are more often males, and then but on the other hand, female patients who have clozapine have a slightly higher rate of incontinence during the night. Right, there's some papers which show that there's some, which reported the mean clozapine dosage. Usually the association between clozapine and the severity of side effects was limited. And this applies to other side effects as well. And what we could see, so we summarize these, and I don't want to bore you. You can look at the paper when you're interested. However, what we find here, that the samples were between in the 20s to the low 100s, and you find a point prevalence or a 1 month's prevalence of nocturnal enuresis induced by clozapine are between 10 and 40%. And this is, I think, something we as clinicians really underestimate. And the problem is we don't ask about that, or if it's collected, we possibly don't look properly at the data, which are collected from all clozapine services and clozapine clinics. The patient might not really report them properly because they find enuresis too embarrassing, and maybe they don't just realize that it could be clozapine induced. So in summary, you find, and you can go through these tables in your own time, There is bias in these studies in a way that there seems to be only low sample size, which is shocking when you look at the amount of data which are collected routinely in clozapine clinic. So there is some selection bias, there's some awareness bias, there's some bias in underreporting. So these studies are not the greatest, and if someone wants to do a decent study, I would possibly recommend to look at the side effects which are reported from regular clozapine clinic, where hundreds of data are collected. Right. Sometimes it's also a problem that what's clozapine-induced enuresis is sometimes not totally clear. But I think that's not the biggest of all problems. The biggest problem is that the attention of clinicians hasn't been properly at this issue, and the data which are collected in clozapine clinics are not properly assessed. Right. There is some enuresis in the general population, especially in the elderly, but on the other hand, this needs to be compared with clozapine patients. And certainly, many of these clozapine patients have developed diabetes, and in this respect, there's some of the enuresis might be related to that. This paper is available at Global Psychiatry Archives. The website is www.globalpsychiatry.co.uk. And if you want to publish with us, please drop us an email on globalpsychiatry@gmx.com. Global Psychiatry, one word, @gmx.com. Thanks for your attention, and I put this up on our YouTube channel. Thank you.